So at my injection training, the key is hands-on training. So when palpating, you want to be looking for what feels like a licorice rope. The needle penetrates, and initially you're in the adipose, which feels like jello. Once you are in the muscle, there are two techniques you can use to actually deploy the liquid that is in the syringe. Trigger point injections. I get questions on TPIs all the time of, can I inject the jaw muscles? Can I inject the lower extremity, the upper extremity, the muscles alongside the spine? Absolutely, and that's the beauty of not just watching a video, but actually getting into class and learning what is the difference when I put the needle in through the skin and going through fat or adipose and down into the muscle. What does that feel like? It's much different when you are hands-on versus just watching a video on how to do it. So next, when we're looking at trigger point injections, there's some very key points on the depth of the needle and the technique to deploy whatever is in the syringe. So one thing that I've used for years in teaching is when the needle is penetrating the skin, it penetrates through the fat or the adipose. That feels like jello when you're the provider. Once you get into the muscle, it feels like steak. Whenever I'm in a lung field or a sensitive area like C3 and higher in the neck, I never go deep for obvious reasons. So I would rather be a little more shallow than go too deep and have what I call a bad day, right? So with this, always err on the side of caution until you learn the needle depth. Completely depends on the body habitus, the size of the patient that you are injecting. So when you are going in, standard of care, gloves, clean the skin, all that good stuff, sterile needle. The needle penetrates, and initially you're in the adipose, which feels like jello, and then you get into what feels like steak, that is the muscle. Once you're in, you can inject a small amount. As long as that skin stays nice and flat, you are in a good location. If you start to see it bubble up a little bit, advance 1 millimeter. You want to go down very slowly until you learn the body habitus on the needle depth for specific patients. The next thing is once you're in the muscle, again, you want to be cautious when you're in a lung field to not go too deep. So once you are in the muscle, there are two techniques you can use to actually deploy the liquid that is in the syringe that will be breaking off the adhesions. There's something called the star technique. That's once the needle penetrates in, you're doing the shape of a star. The needle is not coming out of the skin. It's actually going very slowly while you're deploying the fluid. The needle and the fluid are breaking off the adhesions between the muscle fibers, causing the trigger point to release. The second method is what I call peppering, and I truly think of shaking pepper on my food. So when I go down with the needle, I go down and I just tap, 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 tap like I'm peppering. When I'm peppering and I'm injecting while I'm doing this into the area. So those are the two most common techniques for deployment of fluid into the muscle belly of the trigger point injection. So we really do a deep dive in the hands-on training course. Every muscle, head to toe, all the stuff that is most common, but also what are some of the red flags? As a provider, what do I need to be watching out for? Who is a good candidate for a trigger point injection? Who is not? This is a skill set that is not difficult to learn, but it can help so many patients. And the beauty is you can put what you want in the syringe, whether it is an all-natural anti-inflammatory, whether it is a regenerative type product like a platelet-rich plasma, or an orthobiologic, depending on the patient's specific examination and history. You as the provider hone in and learn and sharpen technique of the skill set of actually doing the injections to all the different body parts. So that is the beauty of your trigger point injections of what are you trying to solve for that patient, but actually really getting in and gloving up and getting in to do those injections because it is different hands-on versus watching a video.